Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Cystocele. Introduction. A cystocele happens when the bladder starts to fall back and pushes against the front wall of the vagina. This program will help you understand what a cystocele is and how it is diagnosed and treated. Anatomy. The female reproductive system is located between the urinary system and intestinal system. The urinary system is in front and the intestinal system is located behind the reproductive system. The female's reproductive system consists of 2 ovaries, fallopian tubes, the uterus, and the vagina. The fallopian tubes connect the ovaries to the uterus, and the vagina connects the uterus to the outside of the body. The urinary system consists of 2 kidneys, the ureters, the bladder, and the urethra. The ureters connect the kidneys to the bladder, and the urethra allows us to empty the bladder. The intestinal system ends in the sigmoid colon, rectum, and anus. The front or anterior part of the vagina is close to the bladder. The back or posterior part of the vagina is close to the sigmoid colon and rectum. There is an area of tissue known as fascia between the anterior part of the vagina and the bladder. The fascia and the muscles of the vagina prevent the bladder from pushing into the vagina. Cystocele. A cystocele happens when the muscles of the vagina and the fascia between the vagina and the bladder can no longer keep the bladder pushed to the front. When the muscles of the vagina along with the fascia can no longer keep the bladder in place, it starts to fall back, pushing with it the anterior wall of the vagina. A cystocele may result from muscle straining during childbirth. Other kinds of straining can also cause a cystocele. For instance, heavy lifting or repeated straining during bowel movements can cause a cystocele. Cystoceles are divided into 3 grades. Grade 1 is when the bladder drops only a short way into the vagina. With more severe Grade 2 cystoceles, the bladder sinks far enough to reach the opening of the vagina. The most advanced Grade 3 cystocele happens when the bladder bulges out through the opening of the vagina. This condition can cause discomfort and problems emptying the bladder. If the bladder does not empty completely after urination, the urine that stays in the bladder may get infected. Urinary tract infections can lead to frequent and painful urination if not treated. This may also lead to the spread of infection throughout the body. A cystocele can also lead to a leakage of urine when a woman laughs, sneezes, or coughs. This is known as stress incontinence. A cystocele may also cause problems and pain during sex. In its most advanced form, vaginal sex may not be possible. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Diagnosis. A healthcare provider may be able to diagnose a Grade 2 or Grade 3 cystocele from a description of symptoms and from physical examination of the vagina because the fallen part of the bladder will be visible. Avoiding cystourethrogram is a test that involves taking X-rays of the bladder during urination. This X-ray shows the shape of the bladder and lets the healthcare provider see any problems that might block the normal flow of urine. Other tests may be needed to find or rule out problems in other parts of the urinary system. These include cystoscopy, where the healthcare provider looks at the inside of the bladder with a specialized scope. Urodynamic studies, which allow your healthcare provider to study how well the bladder empties. Treatment options. The treatment options for cystocele range from no treatment for a mild Grade 1 cystocele to surgery for a serious Grade 3 cystocele. If a cystocele is not bothersome, the healthcare provider may only recommend avoiding heavy lifting or straining that could cause the cystocele to worsen. A set of pelvic muscle exercises known as Kegel exercises may help strengthen the muscles of the bladder and vagina and relieve some of the symptoms. If symptoms are moderately bothersome, the healthcare provider may recommend a pessary or hormone replacement therapy. A pessary is a device placed in the vagina to hold the bladder in place. Pessaries come in a variety of shapes and sizes to give the most comfortable fit for a patient. Pessaries must be removed regularly to avoid infections or ulcers. Large cystoceles may require surgery to push up the bladder away from the vagina and support it so it will stay in a more normal position.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. There is an area of tissue known as fascia between the anterior part of the vagina and the bladder. The fascia and the muscles of the vagina prevent the bladder from pushing into the vagina. A cystocele happens when the bladder starts to fall back and pushes the front wall of the vagina. It can happen after childbirth. A healthcare provider may be able to diagnose a grade 2 or grade 3 cystocele from a description of symptoms and from physical examination of the vagina because the fallen part of the bladder will be visible. Treatment options may include exercises, a supportive device known as a pessary, or surgery depending on the severity of the cystocele. Thank you for using Explain.